palliative care, especially in oncology, really has kind of a few different focuses. So one is thinking about symptoms that might come from either someone's disease or their treatment. That's things like pain, nausea, fatigue, but also issues with mood, sleep, dermatologic issues. Um, the other place that we try to focus is when there are decisions to make about somebody's disease or their health or transitions, we really try to support them in that process to really make sure that we're eliciting from our patients what's really important to them and making sure that the care that they're being provided lines up with what they value most. It can look very different depending on kind of what somebody is dealing with, but it's anything from prescribing medications to prescribing physical, occupational, or speech therapy, recommending exercise, and also reaching out to other team members. For example, there might be a role for, at least on our team, we have a social worker who tends to um, the emotional stress that comes along with cancer treatment. I think that we really serve as a kind of extra set of eyes and ears for the oncologists, for especially for the side effects that you've mentioned. We're working really closely with our kind of partnering oncologists to identify those issues when they come up and work with the oncologists to manage them. I think that I mean, we could spend an entire hour just talking about graft versus host because it can affect so many different systems in the body. And for us, we really, at least I guess for me, I'll speak that, I approach it like any other symptom. I really want to know how it affects somebody's life. What medications or treatments do I have that I can offer that might specifically impact it? And how do I need to be looping in the oncologist to be thinking about their medications and what other tools they may have to help manage it? I'd like to see more and more support for non-medication means of symptom care. In a perfect world, we would be able to offer opportunities for exercise for all of our patients, but we know that there's such a barrier for so many people, whether it's financial or environmental, in terms of actually getting exercise. I think the same goes for just the number of people doing palliative care. We don't have enough to really meet all the people that we'd like to.